My company is called Dakai. We enable clothing brands and promotional distributors to really go from idea to getting their product manufactured ethically and cost effectively through a single technology platform, and allowing this brand to go factory direct. By doing that, we save them 30%, we streamline the entire production tool sets, and we also transform the industry. I actually grew up at a clothing factory in Bangladesh. By growing up there, I have seen the pain points from the manufacturing side, the challenges that they have when it comes to finding those brands. Same for, when I have worked with dozens of brands as well, and I have seen that they're also struggling to find the right manufacturing partners when it comes to sourcing. So it seems like there was a gap in between both brands and the manufacturers, and that's really led us to create Dakai. First time we came in here, we only worked with, I would say, 6 brands, and we did only $60,000 in revenue. Now we have transacted over $1.5 million for our company. We have transacted with 62 brands. We work with brands like NFL, we work with brands like NHL, like L'Oreal, some of the largest brands now. We help them source their products. We're also featured on the NASDAQ, so we have gone through this transformational growth in the last few years. Think of us, we're becoming the Shopify for clothing supply chain, really transforming from the design, sampling, production, logistics, transforming and streamlining this entire logistics and production process for millions of brands. That's really the vision for us.
Right now, school districts are facing a mental health crisis. Okay, they're under a lot of pressure to be able to solve that mental health crisis as well, because mental health impacts student learning. It makes a difference in how successful kids are. And kids that struggle with mental health problems are more at risk of dropping out of school altogether. It is the #1 pain point that school administrators are dealing with across the nation right now. I'm actually a psychiatric nurse practitioner, and my passion is children's mental health care. And so I've been providing services to children for years, and I've realized that the system isn't working for these families, and the cavalry's not coming to help. And that just really inspired me and motivated me to create a change. And I thought there's got to be a solution to this problem. And that's when I decided if I don't help my patients, then who would?
Right now, schools have this huge weight on them of this mental health crisis, and they're kind of like the last one standing. When they find out that we exist and they find out how the model works and how they can make it go, they immediately want to know more. Every district has this as a massive pain that they are searching for a way to solve, and by the time we talk to them, they're desperate really to find a solution. And for good reason. Our kids are not being served well with mental health across the state, and this is a way that districts can fill that gap.
Our business is growing. We certainly have traction. We have paying customers. There's a significant interest, and we are ready to scale up significantly, not just in the state of Iowa, but we have growth plans that include spreading to other states within the Midwest.
We're on Sun Health. We protect our loved ones by automating the body weight, bowel, and bladder charting process for nursing homes and senior living communities. We've created a smart commode, which is a universal retrofit kit that attaches to commodes to capture and chart body weight, bowel, and bladder data at each toileting event. Our solution is meant to be one that doesn't disrupt daily workflow. It sits over the toilet. Once the resident sits on it, we capture body weight, and we take images of what goes on during the toileting event. From there, that data is sent to our web dashboard, where we can set notifications when there's a deviation in a resident's toileting behavior. This was inspired because of my grandmother. She was in a nursing home. She had a bout of diarrhea that was flushed before direct care staff could witness it. In a care community, no evidence means no treatment, and so, from a series of cascading events caused by that hospitalization from dehydration, she passed away 6 months after. Our solution is to provide this quality of care, right? A new standard of care for our nursing home residents, right? Our loved ones. That's done by trying to automate some of the data collection and charting in a nursing home in an industry where there's a significant shortage of staff. When I talk to people all the time on the street, they understand it. When we talk to the care communities, they understand it. In 5 years, we'd like to be nationwide, automating toileting events, getting butts on seats, and ensuring no behind is left behind.